Ladies.
Hello.
Go ahead and have a seat. My name is Dr. Jones, and I'm the exercise specialist here at Limitless Testing Facilities.
Nice to meet you.
Very nice to meet you as well. I see here that the Ferris Cancer Center sent you over here for some exercise testing and programming. Is that correct?
Yes.
Okay. Can you tell me a little bit about your situation and what's going on and why you feel they sent you to see us?
Yeah, they sent me over here because I actually been diagnosed with breast cancer.
Okay, very sorry to hear that, but I'll have you know that we've had breast cancer patients in the past who have been very successful with their testing programs and treatments, and I see here that you have had treatments in the past. Just for us to kind of have an idea, when we're taking you through your testing and programming, how did you feel during those treatments?
I just felt really tired all the time. I fatigued a lot faster than normal, just not really myself, exhausted.
And that's actually expected with that caliber of treatment. Did your physician prescribe you with medication and or chemo, some kind of radiation therapy?
Yes, he is putting me through chemotherapy. He prescribed me medication that's called Relaxafine. I'm still unsure about what Relaxafine is and what it's doing for me, so I would definitely like to know more information on that medication.
I can actually tell you what it is. It is simply a prescription drug that physicians put their patients on to help prevent or treat osteoporosis.
Okay.
And I see here on your chart that you have osteopenia, so that'll help with that. But even more so, the chemotherapy treatments is what it's really targeted towards, so that Relaxafine is probably going to help keep you from getting osteoporosis.
Okay.
And we have the physical testing that we'll be putting you through. The Relaxafine will be beneficial in that aspect as well.
Okay.
And that being said, is there anything outside of commercial facilities, outside your home, that you like to do just for fun, just anything outdoorsy?
Oh yeah, I definitely like to spend like time with my family, and we definitely like to go hiking and go on nature trails, stuff like that. Something we can all do together, but still get like physical activity in.
So you have children?
Yes, I have two children. I have Allie, she's 17, and then Ryan, who's 20. And then also my husband Dave, he's definitely a huge supporter through this.
That is awesome. So tell me, how did your children and your husband take the news of finding out that you had breast cancer?
Well, Allie, my youngest, she's 17. She definitely took it the hardest. She's just kind of struggling with the fact that she thinks I'm not going to be there for a wedding or be there to pick out her prom dress. Ryan definitely is a little bit stronger through this.
He's usually pretty good.
Yeah, I think he's mainly doing it for his sister, but he's definitely more help. So he's always there to jump when I need help, like taking the groceries out of the car, just anything to help me. And then Dave, he's definitely my rock. He's there to lift me up when my faith is a little bit down. He's supportive just for me and the kids. So he's definitely a blessing.
Well, it looks like you have quite the support team on your side.
Yes.
Very much so. Well, that's great to hear, and I really want you to know that here at Limitless, we're going to be just as supportive as they are in getting you through these treatments and getting you through your testing and your program. And here is a chart, like when you're going through your testing and also your programming, where you know the face charts that they have at the hospitals, you know, the happy face down to the sad face. We're going to kind of have you just tell us how you're feeling during your testing, so we'll kind of know how far we can push you in these testing programs.
Okay, awesome.
Okay. So how does that sound good
to
you?
Sounds great.
All right, are you ready to get started?
I'm ready.
All right, awesome. Thank you.
I'm Dr. Whitmire.
Yes, I see.
I see you came back from the Ferris Cancer Center, and I have your blood work in. I'd just like to talk to you a little bit before we begin exercise testing.
Sounds great.
Okay. You're currently undergoing chemotherapy, correct?
I am.
Okay. And it's for your left breast, right? Okay. Any soreness in there?
A little bit, but I know that comes with the chemo. So.
Okay, just a little bit sore. We'll make sure we take that into consideration. You're being prescribed Relaxafine, correct? Also.
I am.
Okay, and that's for your osteopenia. Okay. All right. You're a non-smoker. That's good. We encourage that, especially while you're undergoing chemotherapy.
Definitely.
I would just like to go over a little bit about your blood work here regarding your fat cells in your blood. It's just your triglycerides were slightly elevated. I can show you right here. We just want to get this number down just a little bit, and just you coming in, exercising over time, that'll help get that number.
Okay.
And when we go into programming, we'll go over a little bit more about that.
Yeah.
Okay. Slightly hypertensive, that's just your blood pressure is just a little bit elevated. It's just slightly. We just need to get that number down a little bit.
Okay.
Just certainly something we're going to want to take into consideration while we're doing exercise testing. So now that I've gone over that, I just want to tell you a little bit about what we're going to be doing today.
Okay.
First, we're going to have you get on the treadmill. We're going to have you hooked up to an EKG. We just want to monitor your heart while you're exercising.
Okay.
Make sure there's nothing funky going on in there.
Yes.
We'll be watching your heart rate, blood pressure, and basically it's going to be a max test, so you're going to be a little tired after. We just want you to go until you feel like you can't go anymore. And this is just going to it's going to help us program exercise regimen for you that's going to be helpful and help us reach our goals faster.
Definitely.
Let's see here. Okay, then we're going to go and do some stretching, and we'll do a sit and reach test.
Okay.
Basically what we want to do with that is we don't want you to have any falls, because as you're going through this program you have osteopenia. If you were to fall, you might risk fracturing a bone, and we don't want that to happen. So we want to see how flexible you are and see if we can improve from there as well.
That sounds great.
Okay. We're also going to be doing a functional test.
Okay.
I think it's important that we do that because some of the acute effects of chemotherapy is neuropathy, and we want to make sure that as we progress through this program that you're not experiencing pain. A lot of times people that are going through neuropathy, some of their muscles feel painful and like they're a little off balance. So we want to monitor that as we go through programming. So this is going to be pretty regular to you. You're going to see some things in the programming that seem familiar to the testing, but when we test, we're going to see where you were before and where you are after, if that makes sense.
It does completely.
Okay. Let's see. Family history. Your mother had breast cancer, so you were at risk as well. No other family history of any type of cancer. That's good. Okay, well, I think we can begin. I think it's really nice meeting you. I look forward to working with you, and I'll send you into the next room, and Trey will help you get set up with the exercise testing.
That sounds great.
Okay, nice to meet you, by the way.
Hello, Mrs. Reeves.
Hello.
How are you today?
I'm great.
My name is Trey. I'm the exercise tester here at Limitless Fitness. I see that you met with Dr. Jones prior to this. How did that go?
Yeah, so it went really well. She was definitely very encouraging, and she provided a lot of information for me.
Okay, great. That's what I like to hear. Well, before we begin programming, I want to have to get a couple baseline readings such as heart rate and blood pressure. How does that sound to you?
Sounds good.
Okay, well, let's get started.
Okay, Ms. Reeves, we're going to go ahead and start the treadmill test. So go ahead and step up on the treadmill. This is just a max testing. You go as long as you fatigue. Right now we have you hooked up to the EKG. It's just going to monitor your heart. And we're going to check blood pressure and heart rate. And every 3 minutes we're going to increase the speed, which is going to increase the meds. I'm going to go ahead and put the blood pressure cuff on you. And also while we're doing this, make sure you don't hold on to the rails. Okay, you ready to start? Okay, and go ahead and set your arm up here. I'm going to check your heart rate.
Ms. Reeves. For our next test, we're going to be doing the sit and reach, which is a simple hamstring flexibility test.
Okay.
How you're going to do this test is you want to sit with both your feet. Actually, you would want to take your shoes off first. And you're going to sit with your feet both touching right here on this. And with your knees flat, you're going to place one hand over another and push forward as far as you can when I tell you, and then come back.
Okay.
And we're going to do that test 3 times.
Would you like me to sit
And then
down
take
now?
the average? Yes, if you would please. Just make sure when you go forward, you keep your knees flat against the ground.
Did you say right over left?
It doesn't matter, whichever one you're comfortable with. Okay, you ready? Okay, go ahead. Very good. Okay, if you would, do it again for me. Very nice. Okay, one more time, please. Okay, very good. How are you feeling? You feeling okay?
Feeling great.
Need any drinks or anything?
Oh, thank you. I'm okay.
Okay, you ready to go to the next test?
Yes, sir.
All right, let's
Now we're going to start the balance test. And what we'll do here is you're just going to sit in the chair and get up. And we're going to do it 10 times without using any arm support. You're just going to sit down and just stand up. And if you can't go anymore, just let me know and we'll stop the test. Okay? Okay, and we're going to do this 10 times. Tell me when you're ready. Okay, let's go.
Hello, Mrs. Reeves.
Hello,
How are you doing today?
I'm doing very well, thank you.
I'm Dr. Whitmire. Basically, I'm going to be your personal trainer for the next few months.
Awesome.
Alright, so before we get started, I'd just like to go over some of the goals that I've set forth that we're going to be doing for the next few weeks. First thing is, we want to decrease these blood lipids that we saw in your test results.
What is
Okay, no, that's perfectly fine. Basically, we got back from the exercise testing clinic. We got that your blood lipids were right around 774, and we just like
Is that
to.
terrible?
It's not the number that we'd like it to be.
Okay.
We want to slowly get that number down. So basically, we'll be doing some aerobic activities
Okay.
to get that number down.
Okay.
But I don't want you to worry about it. We're going to take care of you. We'll be doing that mainly through some impact activities. So basically, walking, step aerobics, stair steppers. Does that all sound familiar to you?
Yes.
Okay, and we'll actually, I won't be there when you're doing the step aerobics. I'll give you a video that you can do at home. 'Cause we
can
want-
I have like my daughter do it?
Yeah, and actually I was going to suggest that is, it's always good to get your family involved. We don't want you to feel alone in this process. So basically, I'm going to be here for you and your family should be there for you as well. Okay, so I'm going to continue on telling you some more goals. Improved mood. A lot of times when people are going through chemotherapy, they feel down, they feel depressed, and we don't want that to
second
happen.
that,
Yes,
yeah.
I understand. I have a wife that's going through chemotherapy right now, so no, it's fine. Basically, and we also want to reduce that fatigue that so many people experience. Improve quality of life, increase daily caloric expenditure. Basically, you're going to achieve that from, I know you said that you want to work out in the mornings,
Mhm.
so you'll work out with me in the mornings,
Okay.
and then when you go home later, you can work out there too.
Okay.
Okay.
That's awesome.
Control body weight, that's the next goal, and that's all going to be obtained throughout these 9 months that I have you.
Mhm.
Alright, and then we'll be doing some strength, so basically some free weights to improve strength in the legs, arms, and trunks. A lot of times people start to feel weak.
Mhm.
We don't want that to happen, so we're just going to try and keep that up as well.
Okay.
Okay, and then flexibility and functional training.
Oh boy.
Mhm. Well, that's a good stress reliever sometimes in itself. We want to decrease the chance of falling because I saw that you had osteopenia.
Mhm.
Okay. So basically what happens when you have osteopenia and you're also going through chemotherapy, I'm sure Dr. Jones talked to you about this. A lot of
The
times,
weakening
Mhm.
just kind of adds to it.
yeah, it'll sometimes make you feel, fatigued, and also we don't want you to fall. If you fell, it would increase that chance of a fracture, and we don't want that to happen. So a lot of the activities that we have you do are to decrease the chance of falling, if that makes sense.
Yes, very much
So I just want you to understand when we're doing this balance stuff that it all has purpose, that we just want you to feel like you're not wasting your time or anything like that.
I understand, thank
Okay.
you.
No problem. Okay, so basically we want to increase your range of motion within your joints. So like I said, decrease chance of falling, decrease stiffness, and sometimes that alleviates stress as well.
So kind of like when people do yoga and things like that.
We don't want to do yoga too much, but it's along the same lines, because yoga it's a little bit more intense. We're going to do some pretty controlled stretching, yeah.
Okay, awesome.
Okay. So every once in a while, people with chemotherapy, they start feeling down. So every once in a while, have you ever heard of Tai Chi?
I have. I've never really
Mhm.
seen anything
Okay.
about it, but I've heard that.
Well, we have an expert that is that we're contracting with that knows some Tai Chi. How would you feel about maybe seeing him once or twice a week?
That sounds cool.
Okay, and it wouldn't be extra charge to you. Like he's affiliated with our facility, and we can get you hooked up with him. And that sometimes it just helps some of the stress that you may be
Like
experiencing.
meditation kind of
Mhm.
stuff. Okay, I got you.
All right, so I'm gonna take you to the next room. We're gonna do some more programming in there.
Okay.
So how does that sound?
That sounds awesome. Let's go.
Okay, ready? How's chemotherapy going for you?
It's rough. I'm
Mhm.
not gonna lie, it's pretty rough, but I'm making it through. My exercise program has definitely been
Mhm.
beneficial through it, keeping me on my toes and kind of more energized than what I would be if I didn't have it for the chemo.
So you feel like it's been beneficial to you?
Oh, most definitely.
Okay, well, we were looking to change things up just a little bit today.
Okay.
We noticed in your pre-interview with Dr. Jones that you like to go outside.
Yes, I love to go hiking with my family.
Well, we'd like to, instead of running on the treadmill, or not running but walking on the treadmill, we'd like to get you outside today.
Okay,
All right, does that sound good to you?
that sounds perfect.
Okay, let's go outside.
Yeah,
So how are you feeling today?
Feeling really good, actually.
That's good. How's your family been?
They're doing very well. My daughter is more warming up to the fact that I have breast cancer, but the more active that she sees me, the better she feels, and she actually has been interacting with me like we're doing now, going on walks and things like that. So she's all right, and Ryan is still the same, not letting me do a thing. But and my husband, my rock as usual, he's just perfect.
Okay, that's good. Well, it's been about 10 minutes now, so we should start heading back to the facility, and we'll do the rest of the exercises there. How's that sound?
That sounds perfect.
Okay.
Whew. That was some hard work.
Was it? All right. So you feel pretty tired now, I assume.
I mean, it's a good tired.
Mhm.
It's a good tired.
All right. So I just want to get an understanding, because I want this to be beneficial to you. So what were the two things that you liked most and the two things you liked least?
I would say the two things I like the least
Mhm.
would be probably the strength and the functional training.
Mm-hmm.
The strength because just the weight, I'm sore. So
Mhm.
the weights were.
Did you find it hard to do?
Yeah. The weights
Okay.
were a little much.
Mhm.
But I mean, I was able to do it. It wasn't painful. It was
Mhm.
just uncomfortable.
We don't ever want it to be. There's always a fine line between being painful and being beneficial, and
Yes.
sometimes people don't see the difference in that. So maybe we can lower the weight a little bit, and we can try and go. Really, what we want to do, I have here 10 to 12 exercises. We did those exercises today, and I have it 8 to 10 reps. So maybe we can lower the weight a little bit and still try and get those reps in, because I noticed you were struggling a little bit to get to that 10th rep.
Mhm.
So really, it was indicating that we might need to lower the weight just a little bit so you can get those reps in, because we really, really do want to build up your strength.
Yes.
And that's important because we want you to become stronger throughout chemotherapy, or at least maintain your strength so you don't, if you fall, you're not going to have a fracture or anything due to your osteopenia.
The other one was the functional, just, that wasn't really, I guess I just am not familiar with
Okay.
that kind of
Yeah, and
exercise.
sometimes we want you to feel comfortable throughout chemotherapy, and as you start going through chemotherapy, things are become a little difficult.
Mhm.
So we want to maintain that functionality as much as possible.
So
and-
it's beneficial in the end. It just
Yes,
makes
it's
things
going
odd.
to seem a little strange, a little foreign at first, but we want to progress you through. And basically, some of this functional training goes right around with balance. So we want, again, we want to decrease the chance of falling.
Right.
We don't want any fractures. Especially, you're on that medication right now, the raloxifene.
Yes.
Okay,
Dr.
and
Jones explaining more.
and an important thing about that medication is it's beneficial to you since you're going through chemotherapy right now, but we don't want there to be a risk of other complications. And your triglycerides, like we went over earlier, were a little elevated. And raloxifene is really good at, keeping your bone mineral density high,
Yes.
but there's other risks that medication may bring on that we want to keep the intensity a little low at first. And then when those triglycerides start to go down, we'll start to progress you further.
Okay. The other two, you had asked the positives, obviously.
Mm-hmm.
The aerobic and flexibility.
Mm-hmm.
Flexibility, I would probably say those weren't as bad, just because in my daily activities
Mm-hmm.
before I was diagnosed with breast cancer,
Mhm.
that's
You were-
what I enjoyed
Mhm.
doing was aerobic things, going
Mhm.
hiking.
Something that's familiar
things like
with
that.
you.
Yeah,
we
very
like
familiar. So just the stuff that I'm not really used to doing is just
Mhm.
a lot for me. But I know it's beneficial, and
Mhm.
I know that's what I have to do to get better. So I trust your
Okay.
program.
No, that's fine.
completely.
That's completely understanding. Basically, I'm gonna leave you with some things to do. We have the video for you, the step aerobics video for you to take home. It's a beginner step.
Okay.
When that gets easy, we have some more videos that we have for you that you can do. And like you said, you want to do it with your daughter.
Mhm.
I completely recommend that. It's good to have someone to keep you accountable.
Yeah.
And also, speaking of accountability, would be, I think it might be beneficial if you were to keep a daily journal to try and track what you've been doing. It's easier to, sometimes when people work out, they lose their progress and they don't know. They say, well, I've been working out and I haven't gotten any better, or I can't tell.
Mhm. So it kind of helps see
Mhm.
what I'm
You can see that
lacking in.
you're progressing in this direction, and it helps motivate you to go to the next workout.
Okay.
I have your step aerobics video for you right here.
Thank you.
Alright, and just keep a daily journal about what you're doing with them. So when you go home, you can do it with your daughter. Just make sure you let me know when you progress through that DVD.
Okay.
It's very nice meeting you,
Yes, you
and
as
it's
well.
good working out with you as well. I'll see you tomorrow at 8 a.m.
Okay, sounds good. Thank you.
See ya.